Welcome, doctors, and thank you for tuning in. Today, we're diving into something that's been weighing heavily on healthcare providers everywhere: revenue cycle management, or RCM. More specifically, we'll be talking about why sticking to manual RCM processes in today's fast-paced healthcare environment might be holding your practice or facility back. Let's paint a picture. Managing your RCM manually in 2024 is a bit like paddling upstream with just one oar. You're working harder than you need to, and at the end of the day, you're often not getting where you need to go. We all know how time-consuming, inefficient, and downright exhausting it can be to juggle everything manually. But what's worse is that it's also costly, error-prone, and damaging to patient satisfaction. Now, when we talk about RCM, we're talking about everything from billing to coding, claims submissions, and insurance verifications. All the behind-the-scenes work that ensures your practice gets paid for the services you provide. When these processes are done manually, the chances for errors skyrocket. A simple typo in a patient's insurance ID can delay a payment for weeks, or even result in a claim being completely rejected. And let's be honest, none of us have the time or resources to keep chasing those payments. But it doesn't stop there. Manual processes are time-intensive. Think about all the hours your team spends inputting data, verifying insurance, submitting claims, and following up. Those are hours that could be spent with patients, providing care, offering consultation, or just improving your overall patient experience. But instead, the focus often shifts to paperwork. And let's not forget the cost burden. Maintaining an in-house team to handle all of this manually is expensive. You have staffing costs, training costs, and overtime costs when things inevitably fall behind. For smaller practices or facilities, that can become unsustainable. It's a constant balancing act that's hard to win. On top of all that, we have the regulatory challenges. Healthcare regulations are constantly changing. The rules around billing, coding, payer requirements, and compliance seem to shift faster than we can keep up. Manual systems, by their very nature, lack the flexibility and adaptability needed to ensure you're always in line with the latest changes. That's a huge risk when it comes to audits or compliance issues. And let's not overlook the impact on patient experience. Billing errors or delays can lead to frustrated patients. Patients who don't understand their bills, or worse, patients whose insurance claims get denied due to small mistakes, are less likely to trust your practice. And as we know, patient retention is key to any practice's success. So where does that leave us? With a real need for change. That's where automation and outsourcing come in. The good news is there's a better way. With automated RCM systems, many of the errors that come from manual data entry are a thing of the past. Automated systems can flag inconsistencies before they become costly mistakes, reducing the likelihood of claim denials or underpayments. You can rest easy knowing that your billing and coding are being handled with precision and accuracy. Outsourcing your RCM is another smart move. With specialized teams focused solely on billing, coding, and claims management, you're gaining access to expert-level services without the need to hire and train an entire in-house team. And the best part? Outsourcing often comes at a fraction of the cost of maintaining your own department. Automation also speeds things up. Claims submission, denial management, and follow-ups become faster, leaving your internal staff with more time to focus on what truly matters: patient care. You're not only improving efficiency, but you're freeing up valuable resources that can enhance the overall patient experience. Speaking of patient experience, let's not forget how much smoother things run when billing is faster, more accurate, and transparent. With automated systems and outsourcing, patients are less likely to face delays, misunderstandings, or frustration over unclear bills. In fact, many automated systems offer online portals where patients can view their bills, make payments, and even receive automated reminders, making the entire billing process much more patient-friendly. In short, manual RCM is no longer a viable option in a healthcare environment that demands speed, accuracy, and patient-centered care. The risks, whether they're errors, delays, compliance issues, or rising costs, are simply too high. Automating or outsourcing your RCM processes can help you cut through the noise and get back to doing what you do best, providing quality care to your patients. If you're considering a transition, there are solutions out there that can help. Services like Staffingly, Inc. specialize in providing outsourced RCM solutions that can take the burden off your practice, so you can focus more on your patients and less on the paperwork. The bottom line? Manual RCM is becoming untenable. Automation and outsourcing are the way forward, ensuring accuracy, saving time, and cutting costs, all while improving the patient experience. It's time to rethink how you manage your revenue cycle, and I hope today's discussion has given you some useful insights to get started. Thanks for joining me today and keep providing exceptional care.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.